Knee joint is probably the biggest joint in the body, and knee problems are probably the biggest joint problems in this Indian subcontinent. Almost 23 crore Indians are suffering from knee arthritis. Arthritis, the word means destruction of joint. Now this knee arthritis can be osteoarthritis or rheumatoid arthritis. Osteoarthritis can be primary, which is age related, or it can be secondary, where there is a incidental factor like a fracture which would have happened earlier, or a ligament injury which would have happened earlier. Now this osteoarthritis is an irreversible process. What it means is that we cannot reverse osteoarthritis by means of medicines, just as we cannot reverse the graying of hair. This osteoarthritis can be early, that is early stage, it can be in moderate stage, in advanced stage. Once it is in early stage, we treat with medicines, muscle strengthening exercises and physiotherapy. Once it is in moderate stage, we can do viscosupplementation or synovial fluid replacement, and there are certain surgeries like high tibial osteotomy wherein the tibial axis is corrected. These options are there for moderate osteoarthritis, and once the arthritis is advanced, we have to replace the knees. To understand what knee replacement means, I would show you this model. This is our knee joint, and this is comprised of thigh bone, which is known as femur, and the shin bone, which is known as tibia. At the junction of these two bones is a cushion called cartilage. This cartilage wears out the way our car tires wear out. This causes pain, stiffness, swelling, and instability and deformity, that is bending of the knee. So once it is in advanced stage, we do what is known as knee replacement. We remove the diseased part, correct the axis, and we create a new surface which creates a painless movement. The diseased part goes out like this, and we put in implants which is known as knee replacement. This creates a new surface, new bearing surface. This is a metal which is mostly cobalt chromium or oxenium or even zirconium, and this is highly cross-linked ultra high molecular weight polyethylene, and this plate is made up of titanium or cobalt chromium. This new surface gives a painless movement and corrects the deformity and instability of joint. Now there are various questions pertaining to knee replacement which I often get. One of them is high flexion knee. A person comes that I am an Indian, I want to sit cross-legged for my meditation. Then what would you offer? We have recently come out with rotating platform high flexion knee. Now the beauty of this knee is that there is two-dimensional movement, 2 degrees of movement. One is this flexion extension, and another is rotation, which takes place in normal cross-legged sitting. This gives a deep flexion of around 140 to 150 degrees to enable a person to sit cross-legged on bed, and along with this, because of the 2 degrees of movement, this increases the life of the knee for almost 25 to 30 years. There are certain questions which I get, which means, for example, which is the best implant? To answer this, I would tell you that there is nothing called best implant. You choose your surgeon. You choose your surgeon, and a surgeon as an individual can do best whatever he is doing daily. Thus, I can do best what I am doing daily. Daily I am doing computer assisted minimally invasive knee replacement. Knee replacement is a highly precision based surgery. It is not the brand of implant which matters, but it is the correct precision and accuracy of surgery which matters. To get that, we are using world's most advanced navigation system right here in Kolkata, which is a German navigation system known as Orthopilot. This leads to an unprecedented accuracy, minimally invasive approach, and hence very high performance of knees. After surgery, we deploy interventional pain management techniques like adductor canal saphenous nerve blocks to keep you free of pain for the next 1 month to come. Thus, it allows very fast recovery, accelerated recovery with very less physiotherapy, and thus we are instrumental in bringing world's most advanced knee replacement surgery at most affordable prices right here in Kolkata through the Purva International Orthopedic Foundation.